Look inside the human body, and you'll find two massive networks of flowing liquid. One is the circulatory system, which comes with its own heavy-duty engine, the heart. But right next to it is the lymphatic system, a hidden waste removal network that lacks an internal pump of its own. Because it lacks a central engine, this secondary network has to hitch a ride on your daily physical activity. It relies on your skeletal muscles to squeeze and push the lymphatic fluid along its channels every time you move. This design leaves the human body in a precarious position. If the network is compromised, or if physical movement isn't enough to keep the flow going, the system backs up. Metabolic waste and cellular toxins have nowhere to go, becoming trapped deep within your tissues. Human health relies on a drainage system that can easily stall, leaving the body with no natural way to clear these toxic, stagnant pools. When this biological plumbing fails, the result is a medical condition known as lymphedema. This occurs when the lymphatic network is damaged or overloaded, leading to a massive, painful accumulation of fluid. Often, the trigger is surgical trauma. Patients undergoing major cancer treatments frequently require the physical removal of their lymph nodes, which severs the body's natural drainage pathways. But the damage doesn't have to come from a scalpel. A microscopic parasite spread by mosquitoes can cause an infection called filariasis, which attacks and destroys the lymph nodes from the inside out. Without an upward flow to fight gravity, all that trapped liquid sinks. The fluid pools heavily in the extremities, expanding the lower legs and feet well beyond their normal size. The physical reality of this biological failure is agonizing. The stagnant fluid causes deep tissue edema, skin discoloration, and debilitating joint swelling that limits mobility. All of this presents a massive physiological problem. How do you clear out a failing biological network when the body's natural mechanisms for draining it have been destroyed? The answer takes us back to France in 1932. Two researchers, Emile and Estrid Fader, were studying the lymph vessel system, looking for a way to bypass this anatomical dead end. The Vaders looked at this blockage and realized that if the internal mechanics had failed, they could be bypassed using external pressure. They devised a sequence of mild, rhythmic manipulations applied directly to the skin. By pressing in exact patterns, their hands functioned as an artificial biological pump. The results were effective enough that they formalized the technique into a treatment called manual lymph drainage, eventually establishing the Dr. Vader Center in Denmark to teach the method across Europe. The mechanics of human touch were now being used as a physical substitute for a missing internal function. Let's look at the exact mechanics of how manual lymph drainage works. A trained professional applies customized, wave-like pressure, essentially acting as a physical escort to push fluid toward healthy, working lymph nodes. This external pressure creates an internal vacuum effect. It forces trapped poisons out of the stagnant surrounding tissue and guides them back into the waste removal channels. While clinical MLD is highly effective, it requires an expert. So a widely accessible alternative called simple lymphatic drainage, or SLD, was developed. SLD takes the advanced maneuvers used by professionals and simplifies them into a 20-minute routine. This allows patients to perform the systemic flush on themselves, often right before bed. The clinical technique was successfully adapted into a routine that individuals could maintain on their own schedule. Restoring this fluid flow directly addresses the symptoms of chronic conditions, starting with the systemic tissue destruction seen in rheumatoid arthritis. As rheumatoid arthritis worsens, patients experience restricted lymph flow. The manual drainage clears that localized swelling, offering a physical reprieve from the intensifying joint discomfort. Patients dealing with fibromyalgia find similar relief. The targeted pressure reduces cutaneous nerve irritation, lowering tissue stiffness and decreasing depression in affected individuals. This diagram shows a leg suffering from chronic venous insufficiency, where malfunctioning vein valves make it difficult for blood to fight gravity. By massaging the tissues, the treatment boosts struggling blood flow, improving the performance of the femoral artery in the thigh. Artificial manipulation of lymph fluid creates a pathway for relief, reducing the structural pressure on both the nerves and the veins. You don't need a severe medical diagnosis to benefit from these mechanics. The exact same fluid clearing process is effective at targeting everyday issues, like stubborn water weight. Manually driving fluid out of the lymph nodes, physically debloats the abdomen and relieves the heavy, dragging sensation of puffy legs. Forcing the system to efficiency carries striking aesthetic effects. Practitioners use these motions to help break down fat cells, progressively smooth cellulite, and accelerate the recovery timeline for sports-induced swelling. Because the massage removes toxins while boosting local blood circulation, patients typically finish their sessions with visibly glowing skin. Beyond the physical mechanics, there is a mental release. The broad, sweeping motions release long-held physical tension stored throughout the body. Lymphatic drainage massage serves as a vital manual override for our biology,